Okay, so if you read and understood, considering your surgical anatomy station, please tell me, what are you looking at?
Okay, so this is an image of gluteal region
Yes. Can
with
you,
hip bones
with hip bones and the muscle layers which are
and the
arranged in
sacrum.
2 layers, superficial and deep. Okay, that's
Okay.
the whole description
Okay,
that you
for
have
the
to tell, please.
superficial layer, the first one is on the
Yes, this one. This is
right
the
side, which is
okay.
yes.
This is left
The
side.
superficial is on
My
the right side. Oh, is left side. Okay. Yes.
Yes, my left side. I'm sorry. So what is this muscle? If you can
Yeah.
please kindly identify
Um,
with the cursor.
that one is gluteus medius.
Okay. Can you tell me the origin and insertion and the nerve supply action of this muscle, please?
So gluteus medius is inserted into the posterior aspect of the ilium on the anterior gluteal line.
Okay.
And the muscle is inserted into the greater trochanter
Okay.
along with the gluteus minimus. The nerve supply is superior gluteal nerve.
All right. And the action?
Is a adductor of hip joint.
All right, very good. Can you identify this muscle, please?
Abductor of hip joint. This is a gluteus maximus.
Okay. Right. Moving on to, okay, on the right-hand side, there are the deep layer of muscles. Can you please identify this muscle?
The gluteus minimus.
All right. Moving here, if you can please identify this one.
This one, it seems like a piriformis.
Yes. Good. And then there is one muscle over here.
This gemellis superior.
Very good. Again, this one.
Obturator internus.
Internus, very good. Nice. This muscle, if you can please identify.
Gemellis inferior.
Right. And one lower here.
Yes, is quadratus femoris.
All right. Please tell me the attachment of quadratus femoris muscle.
So quadratus femoris is originated from the ischial tuberosity and inserted into the quadrate tubercle of the femur.
Okay. And its mode of action is?
It's
lateral rotator of the thigh.
Yes, lateral rotator of hip joint.
All right. Thigh. Okay. So which nerves supply the gluteal region of the body?
So the gluteus maximus is supplied by the inferior gluteal nerve, and
yes,
minimus and medius is supplied by the superior gluteal nerve.
All right. Okay. Can you please tell me if you can identify on the left-hand side, there is picture A and B. If you can identify number 3 over here.
Number 3 is the head of the femur.
All right. If you can identify number 2.
Is greater trochanter.
6, please.
Is neck of femur.
All right. 4, please.
Is intertrochanteric crest.
5,
this
please.
one is intratrochanteric line. 5 is lesser trochanter.
Okay. 2, please.
2 we said is greater trochanter.
All right. Can you please tell me what is number 9?
Is a surgical neck of femur.
Are you sure? It's the shaft. All right. Number 5.
Yes, shaft is lesser trochanter.
11.
Intratrochanteric fossa.
Okay. Can you please tell me how the hip joint is formed? What type of joint is hip joint?
Is a ball and socket type of synovial joint.
Yes.
So 3 hip joint fused together.
3 hip joints.
3 hip bone is joined together to form
acetabulum,
and then the head of the femur is joint there as a ball and socket type of synovial joint.
Okay. What are the movements which are present at the hip joint?
Is flexion, extension, adduction, abduction.
Yes.
And medial rotation, lateral rotation.
Okay. Right. Can you tell me what are the factors which strengthen the hip joint?
Okay, so the deep acetabular cavity and muscle, ligament, capsule,
And
angle of the neck of the femur.
Very good. Okay. Right. Can you please tell me? All right. One important question that I wanted to ask you. Right. What are the factors which stabilizes the stance of a walk or stance? Okay.
Is tensor fascia lata.
Yes. All right. Moving on. Right. Can you tell me what kind of image are you looking at?
This is a CT angiogram of pelvis.
Okay. Okay. In which conditions would you ask for it? What are the
So
indications?
any condition like any trauma, vascular trauma suspected, or maybe a patient with dry gangrene or wet gangrene,
Okay.
or a patient with acute limb ischemia.
Would you be able to identify the structures labeled on this image? What is
So
one?
number one is
Catheter. Okay. Two.
a femoral artery.
Okay. Three, please.
Three is lateral circumflex humeral artery.
Four.
Four is medial circumflex humeral artery.
Right. Moving on. 5, 6, and 7, please.
Okay, 6 is superficial femoral artery. Number 7 is a profunda femoral artery.
Yes.
Number 5, I'm not sure.
Okay. Right. Moving on. Can you please identify the image you are looking at, please?
So this is also a CT angiogram. It seems like it's on the popliteal artery and it branches.
All right. Very good. Can you please, here you can see there are certain
that
labels.
one is popliteal artery.
Yes, very good. Moving below, please identify.
This one is posterior tibial artery.
Tibioperennial trunk.
Or tibioperennial trunk, yes.
And this one, please.
Anterior tibial artery.
Yes. Please, this one, identify.
This is peroneal artery.
Okay, and
this one is posterior tibial artery.
Very good. Good. All right. Quickly, if you can tell me what is a popliteal fossa? Boundaries and contents, please.
Okay. So popliteal fossa is a posterior part of the knee joint, which is bounded by superior and laterally by the biceps femoris, and medially by the semimembranosus and semitendinosus, and inferiorly medially by the medial head of gastrocnemius and laterally by the lateral head of gastrocnemius, and floor is by knee joint and ligaments.
Yes.
And roof is by skin and superficial fascia. Superficial
fascia and skin. All right. Contents, please.
Contents is
deep to superficial.
Okay, so deep will be popliteal artery.
Very good.
Popliteal vein.
Very good.
And superficial will be tibial nerve and common peroneal nerve. And deep also, like some lymph nodes is there, and superficial short saphenous vein, sural nerve, and
did you mention tibial nerve?
Yes, tibial nerve. I said tibial nerve and common peroneal nerve. They are superficial.
All right. One last question. Can you please tell me the surface marking of the sciatic nerve? And these questions you have to answer quickly, right? In exam.
Yes, that one. Okay, ma'am.
You can come back to this one later. Okay. But off the record for your like ease or for your memory, L4, 5, S1, 2, 3, right? So this is the.
Oh, you asked the root value?
No, but that's how it begins.
Surface marking.
Surface marking, yes. But that's how it begins and then exits.
Yeah, that one I know.
Okay, because now that if I ask you this question, then only foot will be left. So if we can quickly answer that, all right, from medial to lateral,
Okay,
you
ma'am.
tell me the organs in the femoral region, the structures in the femoral region.
Okay, you mean the femoral canal?
Yes, femoral
Okay, so
canal
from
or in the femoral
canal,
region.
it will be femoral vein, femoral artery, and femoral nerve.
All right, and then the most medial is which structure?
The structure is femoral vein is the most.
No, femoral canal is the most medial.
And femoral canal is medial to
Yes.
femoral vein. Yes.
Please tell me one physiological and one pathological advantage of the femoral canal.
So femoral canal, it gives the space to expand the vessels like femoral vein, artery, and maybe limb vessels. And pathological, it may potential space for the femoral hernia.
Good, very good. Okay. I assume that you would know the boundaries of the femoral triangle.
Yes, I know.
All
So
right,
femoral
good.
triangle is superiorly by inguinal ligament, laterally by sartorius muscle, and medially by adductor longus.
Good. And the floor? Because
And the
this is
floor
very
is by
important.
pectineus muscle, iliopsoas muscle, and adductor longus muscle.
Yes, good. All right. With this, we end most of the lower limb, except for the foot. Foot itself is very long, and we need to have another session for that.
Okay.
Good. Thank you.
Thank you, ma'am.